Hi everyone, it's Wayne Tucker. In this next video, I want to talk about developing an on-call system. I did talk about, in terms of infectious diseases, in terms of an on-call system and how it worked, but I kind of want to go through how we developed a new on-call system for a public health unit where I was working. Um, Myself and another director were fairly new at this health unit, um, and was quickly within a few months of being part of the regular on-call system. We had some serious concerns about how the system was working and the level of protection it was providing for the community for a number of public health issues. So we talked to the medical officer of health and to see if if we could actually think about putting a different type of on-call system in place, and we explained our concerns to the medical officer of health in terms of that we felt the risk that was occurring on the evenings and the weekends. He was very listened to our concerns and certainly shared those concerns when we explained to him in detail. So the initial on-call system that was in place when we both arrived involved, I would say I think all the managers, but it also involved the business administrator, the HR manager on call, and probably the HR and the business administrator probably were the staff that was on call that we probably had the most concern about in terms of their experience, not being in infectious diseases and dealing with these health hazards and public health issues after hours. So myself and the other director went away and we developed the protocol of set up a new system. We wanted to make sure that the right calls were going to the right person after hours. So what the system would involve would be for the communicable diseases side, if there was any issues related to infectious diseases, outbreaks, anything that was going on with the vaccines, because I was responsible for the vaccine program. Anything in regards to cold chain, any of those issues, those calls from the public health inspector that would be taking those calls they would consult with me or one of my managers if that person was on call. If it was related to food safety, health hazard, anything of that nature, and environmental issues in the community, then the public health inspector would direct that call to environmental health, and either the director would be on call to take that to provide consultation, or a manager from environmental health would be on call to take that information. This was ensured that like I said earlier, that the right person was taking that call at a management level, and it worked extremely well. Sometimes, myself, if I was on call, some issues would involve environmental health, so I would be reaching out to that person that was on call, and vice versa. So it was a very good on-call system to put in place to ensure that the appropriate risks in the community would be taken care of in an appropriate manner, and that no issue was going to be dropped. And the main reason, both myself and the other director were concerned was that we didn't want something to occur after hours and weekends that would really put the community at a serious risk. A lot of things, both the environmental health and infectious diseases side, involved making that right call, and we felt that the system would provide that. Just to give an example, for myself on the infectious disease side, I'll just use a different example this time. In terms of maintaining a cold chain for the vaccines, a decision, I could get a call from a location of an alarm going off on one of the vaccine fridges. So I would have to make the decision whether the public health inspector would drive, for example, it could be, just 30 minutes to the satellite office or to the main office, or that person could have to drive an hour and a half to get to another satellite office. But the implications were very serious in this example, because if there could be $30,000 or $40,000 of vaccine in that fridge. So it was important to, even though it involved, minimal hours for the public health inspector, if we weren't able to resolve it or get some information on the phone, which is after hours would be usually not possible, then I would be directing the person to go to that site and check at the fridge and ensure the vaccine supply was safe. Like I said, it doesn't take very much for the cost of the vaccines in the fridge. If it goes outside a cold chain and can't be used, that can result in a significant loss of vaccines for public health. So it just kind of provide an example where, to look at a situation, I think, where when you're coming in this case, myself and the other director realizing the risk that we didn't think that was a good system and was too much risk associated, that we wanted a system put in place that the appropriate people were taking those calls and add the background and experience to providing information and making decisions and helping the public health inspectors that were on call during those after hours. Thank you very much.